Hello everyone. Today we will present bacterial meningitis that caused by Streptococcus pneumonia. Bacterial meningitis is infections of the meninges caused by bacterial infection. Most common bacterial causes of meningitis in the United States is Streptococcus pneumonia, group B Streptococcus, Neisseria meningitis, Haemophilus influenza, Listeria monocytes, less common Staphylococcus aureus, Mycobacterium tuberculosis, Treponema pallidum in human immunodeficiency virus. Morphology of Streptococcus pneumonia. Gram-stain positive morphology, the shaped lancet-shaped spherical cocci, arranged in pairs or short chains. Capsule positive, acid fast negative, cell size 0.5 to 1 micrometers. Non-sporing, non-motile, colonies appear small, 1 to 3 millimeter in diameter, round, smooth, mucoid, unpigmented, and translucent. Colonies are alpha hemolytic when blood agar when grow aerobically, and beta hemolytic when grows anaerobically, facultative anaerobic.
Distribution. Where is the pathogen found? Streptococcus pneumoniae resides asymptomatically in healthy people and colonizes the respiratory tract, sinuses, and nasal cavity. It is commonly found in the nose and throat, and it can be there at any time without causing any harm. Mode of transmission. Streptococcus pneumonia usually spreads by direct person-to-person close contact with others, such as kissing. It also usually spreads through droplet transmission by breathing in droplets produced by an infected person during coughing and sneezing. It can also spread indirectly through contaminated objects such as sharing personal items. Risk factor. People of any age can develop bacterial meningitis, from newborns, babies, and young children to teens, young adults, and older adults, but it is most commonly seen in younger children and elderly people since they are the most susceptible to the disease due to having weaker immune systems. Those who are immunosuppressed, have weak immune systems, are in close contact with others, such as in living in college dorms, and those who have had head injury, sustained skull fractures, undergone neurosurgery, and those who have medical problems such as living without a spleen are also at risk. How do the bacteria do damage? The bacteria insert a chemical called phosphorylcholine into their cell walls. When it binds to receptors on cells in the lungs, meninges, or in blood vessel walls, it triggers the phagocytes to engulf the bacteria, but it doesn't completely digest it due to its capsule. The capsule and phosphorylcholine allow the bacteria to hide inside body cells and pass across infected cells and enters the blood and brain. Once it has invaded the bloodstream, it can move across to infect the meninges, and bacterial meningitis occurs. The meninges are filled with cerebrospinal fluid, which surrounds the brain and protects it against physical damage. There, the bacteria can multiply freely and release pneumolysin toxins that cause inflammation and swelling in the meninges and brain tissue. This increases pressure on the brain, producing symptoms, which I'll talk about in the next slide. The major signs and symptoms of bacterial meningitis are high fever, headache, stiff neck, photophobia, which is when the eyes are more sensitive to light, altered mental status such as irritability, confusion, and drowsiness, and nausea and vomiting. These usually occur within 1 to 3 days after exposure. Mortality rate. Bacterial meningitis is a serious life-threatening condition with high mortality. It can be fatal, and between 10 to 15% of people who get the disease will die.
Diagnosis based on physical examinations, cerebrospinal fluid analysis, where they can find white blood cells count, protein, glucose, and also polymerase chain reactions. Treatments include the antibiotics, ampicillins or penicillin, vancomycin for coverage of resistant Streptococcus pneumonia. Corticosteroids are used to reduce inflammations and relieve symptoms. Vaccinations is very important. They include pneumococcal conjugate vaccines are usually prescribed to infants and young children, and pneumococcal polysaccharide vaccines are recommended for older adults and people. Complications of bacterial meningitis, ataxia, hearing loss, cognitive dysfunctions, cortical blindness, hydrocephalus, seizures, focal paralysis. The next slide, preventions include vaccinations, pneumococcal vaccines, avoiding risk factor, antibiotic prophylaxis, early diagnosis and treatment. Thank you for listening.